Namaste, and welcome to our continuing series on homeopathy with our beloved Dr. Pachegaonkar. You had a question from one of our listeners on kidney functions.
Yes.
Could we take that up?
Yes. Kidney function is a vital function in our body. We have two kidneys almost of the size of our fist. And mainly it is a function of purifying the blood, filtering the blood in our body. And kidneys have tremendous capacity. Two kidneys together can filter up to 200 liters of fluid in one day. Imagine. 200 liters of fluid can be filtered, and it is like a reverse osmosis. Our kidney comprises of millions of tubules, nephrons, and each tubule carries blood through it, fluid through it, and whatever ingredients are necessary for our body are again absorbed in the nephron, and remaining is allowed to pass further, which is urine. And when it passes further through pelvis and ureter, it is collected in the bladder, and once the bladder is about 75% full, say about 300 to 350 ml, one gets urging for urine, and we empty it as per convenience. So this is the system. So imagine in one day our kidneys are filtering 200 liters of fluid, but the urine output is hardly 1.5 liters to 2 liters maximum. So anything above 1 liter to 2 liters is average urine output. That means our each drop of blood is purified every 30 to 40 minutes. So that is the outcome of kidneys. So kidneys have multiple functions. In the sense, whatever is essentially there in the blood, it is absorbed, and remaining unwanted things are allowed to pass further. So kidney is the route for so many things which need to be excreted. So many, like medicines, antibiotics, even excess blood sugar, these are excreted through urine. For simple example, like glucose, the carbohydrate. Now, if the blood sugar level of our body rises above 180 milligrams level, then the sugar is excreted through urine. So we call it a renal threshold. So it regularizes the blood sugar level in the body. Now what we do is, many times we check blood sugar as well as urine sugar for one reason, that if the person has blood sugar level which is raised even above 250 grams per, like, and even then the person is not passing sugar in the urine.
Sufficient urine.
Yes. No. Sometimes the renal threshold may get tampered. Person may pass enough quantity of urine, but it may not contain carbohydrate. So we definitely get worried that the person, in spite of raised blood sugar, his urine is not containing glucose. That means the body is not reacting efficiently to the increased level of blood sugar. So with that interpretation, we start treating it. So kidney has multiple functions, and if it fails, then the serum creatinine will be raised, blood urea will be raised, and then again subsequent to that there would be blood pressure rise, then there will be nausea, vomiting. So many disorders can come with this. So the suppression of urine, sometimes the filtration is not proper because of death of nephrons, It can be autoimmune disorder or it can be iatrogenic. There are kidney toxic medicines which people consume. Now you see these routine painkillers, vagus inhibitors or these painkillers. Now our health authorities are making it mandatory for those companies to add a warning on that this is a kidney toxic drug.
Oh.
So we have to take care.
So even common things like aspirin, Advil.
Yes, but
These-
like statins. Statins also are known to temper the kidney function. We have a case here. We were treating it for nephrotic syndrome where this female was passing lot of albumin through urine, proteinuria. And she was getting deficiency of protein and because of that the bloating. We treated it for 2 years and her nephrotic syndrome was absolutely normal. And after 4-5 years, she came again with a relapse. With homeopathy, the relapse doesn't occur because we don't palliate. We just educate the body to cure it. So the disease should not relapse unless there is some maintaining cause. Then we started probing, and then she said that she has started taking statin for her increased cholesterol. And on that statin, in the drug effects, side effects of the drug, it is mentioned that people with kidney disorder should not take it, contraindicated. So there are so many medicines which need to be carefully taken so that kidney functions are not affected. But kidney functions are very important functions. And the worst part in kidney disorders is, especially in renal failure, the person is absolutely fine till it is, an advanced stage. So renal failures, you hardly get any symptom, and once you start getting symptom, it is too advanced. So one has to be very, very careful with the kidneys, but proper hydration, maintaining it will be definitely like proper hydration in throughout the year. In summer, winter, it should be better. Another common condition in kidneys we get is renal calculi. Renal calculi can remain silent unless it is causing any discomfort because of its position.
And what about size?
Yes. If it is like, see, any gravel of 2 mm or lower size, we don't consider it calculi, it's very common.
Okay.
But if it is about 2 mm and up to say 4 to 5 millimeters, these kidney stones are excreted easily by the body. The lumen, the ureter and the urethra can accommodate it and it can negotiate through it with little bit of bearing down pain and tenesmus. So if you adequately hydrate, the kidney stones are passed easily. But many times what happens, if it is of larger size and it gets stuck in the passage, especially in ureter, where the ureter opens into bladder, that what we call uretrovesical junction. If it gets stuck there, there would be a retrograde pressure upon the kidneys, and that retrograde pressure can cause so much of discomfort and backache in the renal angle. And many times this retrograde pressure can cause acute renal failure where the kidneys stop functioning. And the problem is, if one kidney stops functioning, reflexly the other kidney also gets affected. So we have to be very careful so long as if there is a severe grade of hydronephrosis. But if it is like a milder grade of hydronephrosis, we can definitely facilitate body to excrete the calculus in the bladder, and once it reaches in the bladder, then kidney doesn't get affected at all.
If you could discuss the coloration of the urine as it passes through.
Yes. Ideal conditions are where it should be colorless. It should be like water coming out. That's the best. It need not have odor, and it's completely bland, like there should be no burning or discomfort. But sometimes if urine is concentrated, where your body is not supplied with adequate amount of fluid, then it may get concentrated and then it may become yellowish tinge would be there. But we have seen many times that if there are, like I remember a child and there was a color pencil which was consumed by the child,
Oh,
and the child was getting blue color urine next day. And on doing the history, then the elder sister sibling, hardly 3 years elder to it, told that yesterday she has consumed the pigments of that pencil. So it can happen. It may change depending upon what you have eaten. We have seen like people taking B complex capsules or
definitely it's going to
tablets.
be
They
yellow.
would the urine
will
would
be
be
yellow,
yellow, but
yeah.
in normal course it should be like plain water.
Okay. Thank you so much.